Our next speaker is Bill Patterson. Bill and I have known each other for a number of years now, and really I'm still learning about what the Coastal Healthy Community Coalition does at the University of New England and what it does for all of our communities in southern Maine. It's a broader network throughout the state. They receive both state and federal funding. But through this opioid issue, I've gotten to know some of what Bill does, and it's really inspiring to see some action taking place and some tangible benefits that are occurring. So Bill, I think you're in the audience here, thankfully. I didn't check right beforehand. Bill Patterson.
Good morning. I get to have you right before lunch, and my daughter said, Dad, you better bring some Snickers. Throw them out to everybody. Ed, I'm wondering if we have product placement here, if we can get a grant from Poland Springs. How many of you are not from Maine, and this is your first visit? Any? Or, not, okay, yeah, is this your first visit? Not from Maine, you're from away, okay. Is this your first time in Maine? Second time, okay, well welcome anyways, and welcome to the program today. I feel very honored and blessed to be part of this program, and thank you, Dr. Bilski, for having us here. We'll learn and try and share a little bit more about what Coastal Healthy Communities Coalition does. An offshoot of that is called Project Alliance. My name is Bill Patterson. I'm the program director for substance misuse prevention. I'm a prevention specialist and also manage the drug-free communities grant called Project Alliance. And we want to talk about how that ties into pain management, how that ties into promoting healthy, safe, and productive communities, and working together. We're all partners in this, but working together to reduce substance misuse in York County and in the state and across the country. I'm also the co-chair of the Maine Opiate Collaborative Prevention and Harm Reduction Task Force, which was created by the U.S. Attorney for Maine and the Attorney General. Our Dr. Mills' sister, Janet Mills, here in the state of Maine. We've been going around the state listening to various community groups, and I've learned a lot from that. So today I'm going to share a particular program with you, but let's move on here. I'm going to skip through this. There's a lot of words here, but basically this part of York County, which is the southernmost county in the state of Maine, basically is about 24%. My department covers northern York County with our grants from the state and federal government around prevention. But I wanted to point out that we have a very diverse group of communities here. We have wealthy communities, coastal communities. We have rural. Once you pass the turnpike, on the other side of the turnpike, it is very rural. We also have municipalities in downtown Biddeford, which is going through a renaissance right now, old mill towns, as well as a resort town like Old Orchard Beach, which in the off-season has approximately 8,900 population and explodes to over 120,000 in the summertime. So that creates huge public health and public safety issues and challenges that we need to deal with as all these people come into our communities, and now there's more of a peripheral season. I'm going to skip through this, but basically right up here is where we're dealing. We're doing a lot of work in this area right here, and particularly the Old Orchard Beach, Saco, and Biddeford. And where we're sitting is right here on the Saco River, which comes down from the White Mountains just a little bit. This shows you, here's the off-season. Here's the summertime. Okay, and Old Orchard, which is just north of here, has a pier and probably the most bars per square foot in the state. So we're dealing with a lot of underage drinking, fake IDs, those type of things, and we address those in programs. But we also have a lot of great businesses in the area, and that's the pier that goes off of the beach. And there we are surfing. That's a picture of one of my family members. We all love to surf, and this is last fall, right after. That's our natural high, I guess. I'm very concerned right now what I'm seeing, since we're talking about pain management, and particularly around prescription drug misuse. The Maine Integrated Youth Health Survey is given out to all our middle schools and high schools that wish to cooperate, and I think we have 100% cooperation in our district. And it asks a number of different types of health questions. But I'm really concerned right now with a couple of things, and one is an upswing in prescription drug use. In the past 30 days, we're seeing about 1 out of 6 high school students using prescription drugs that weren't prescribed to them. and also the perception of harm around marijuana use in teens. We have that on the ballot coming up in November, and that has gone down tremendously in the past 2 to 4 years. So this particular survey is given out on the odd year. So next year, 2017, we'll be seeing that given out to the middle and high schools, and some 5th and 6th grades if they want to participate. So just quickly, substance misuse prevention, which is the new term. We used to call it drug abuse prevention or substance abuse, and we're starting to change that terminology right now. It's a process that attempts to prevent the onset of substance use and or limit the development of substance use disorders. We want to cut down on that. We want to increase the protective factors in our communities and decrease our risk factors, and particularly with our youth. And most of our grants are youth-oriented. And so we have a number of different types of prevention activities, and one concept is known as an environmental, basically, prevention, which focuses on changing community conditions or policies that are availability of substances. We want to see that reduced, perhaps, in appropriate cases, as well as the demand for these particular, whether it's alcohol, tobacco, opioids, and other drugs. And basically, we look at 3 plans for prevention. Family-based prevention programs. We have a program that we're launching this fall called Table Talks, and it's neighborhood parent programs where parents get together, whether it's in a faith-based community, whether it's in a neighbor's house, whether it's in a library in a community, and we discuss through trained personnel and parents talking to parents about underage drinking and marijuana and teen use, in this particular case. And heroin eventually comes up at those meetings and other types of prescription drugs. So we'll be addressing that this fall. It's a fantastic program that I really like, and we've had very good evaluations on. School-based prevention programs. And I know that Ed also goes into the schools and his team looking at the brain and brain science, which is fantastic. We've learned an awful lot in recent years about the neuroscience and how it all relates. We're all partners in this. School-based programs, one that we're also launching this fall is called the All-Stars program. It's an evidence-based program that works with middle and high schools. Fantastic. It's been around for a number of years, and on September 13th and 14th, we're going to be training teachers and administrators and school resource officers and healthcare personnel in that particular program to add just another tool into their toolbox. Because there's a lot going on in the schools already. We want to make sure that we can evaluate these and assess, and reassess. Today I'm going to talk about community prevention programs, and one in particular that ties into particularly the heroin epidemic that we're seeing right now and opioid use, as well as other medications. And it's the basically drug take back and programs such as that, which I'll talk about in a second. I also want to talk about, and will talk about, the building of relationships. And as Ed had mentioned earlier, we're growing in our relationship, but we all have relationships, whether it's with patients, students, coworkers, our kids, grandkids, and our neighbors. And I've found those connections are extremely important. I've spent years building relationships in this area just so that I could get programs like All Stars into place. And be available in a very sincere way. We're selling a product, and that is health and wellness. And so we want to make sure that we continue to build relationships, strong relationships with all of you, that you're representing a number of different factions, and out in the communities to keep them healthy and safe. I have to share this story really quickly with you. I went to talk to 4th graders. Any of you ever talk to 4th graders? Maybe your own. I know I have a deer in the headlight. Look, I have 8 kids, believe it or not, and so I've had 4th graders flying by me. 4th graders are really cool because they're really honest. And you could talk about tobacco or you could talk about alcohol. In this case, advertising. You have to be real careful because very often they'll go home and their parents maybe one of the parents is a social drinker, has a glass of wine with dinner, and they'll call them an alcoholic or something. You just have to be very, very careful with how you present and get feedback from them. And I learn all the time from young people. But there was a young man, I asked, what does peer pressure mean to you? And the class didn't respond, and I'm like, geez, maybe I'm missing the mark here. And then finally in the back row, a young man put his hand up and said, well, it's when we're out on our boat, and my dad and I were coming in, and we throw those white squishy things off the side of the boat, and we come into the pier. And then it keeps the boat from getting really scratched up. For a second, I was like, okay. And he started getting peer pressure from his students that were in there. And I didn't want to laugh, but I thought it was, that's how he's perceiving it. There they are. See them right there? Ed, you're probably familiar with them with your boat. That's Maine. I mean, we have a lot of coastline here, and so that's how he perceived peer pressure, a peer. Okay? So, I want to just quickly talk about when we're dealing with communities and we're communicating, and I'm probably preaching to the choir here, right? There's something called the arc of distortion that I've become really familiar with. And that means what I'm saying here may not necessarily be what you're hearing. And I have to remember that with students. I have to remember that when I'm working in communities, working with staff. And that happens quite frequently. So how we want to deal with that is to really ask, does that make sense to you? Is that okay? Do you see what I'm saying? Constantly assessing and reassessing our community efforts in evaluating. And so I'm constantly doing reality checks in our communities. And that's what that arc of distortion is. And I've been fooled by that many times. And so what I'm saying, hopefully is clear for you today. So communicating is effective. I'm going to skip through this. But we really want to provide best practices in prevention, the best we can do, and read the research. There's been a lot of researchers talking today. So I like to take your information, translate it for the general public, and how we can help keep our young people and all of our populations healthy, safe, and productive, and have fun. We also ultimately need to sustain these programs when the grant funds run out. How are we going to do that? How can we get these relationships into place so that we have people who will continue with these programs? Yes, funds are important, and we thank everyone who's been involved in that, but we need to be able to sustain our programs. So I'm dealing with demand reduction, and we need to be able to really sustain that. Our community partners continue to grow and are awesome. Not only are our senators and our Congress people been very healthy in terms of getting laws passed and funding, but we also have a local Rotary who's been very involved with their Red Ribbon Committee. It's been fantastic, mentoring programs. And they are really action-oriented. And I know, Ed, you've spoken with them, and Jim Godbow and all. They've become a huge ally with us in the work that we're trying to do in our community. We also have a group called YPR that you may have heard of, and I've got, somewhere in here I've got my little wristband on from YPR, Young People in Recovery. And a gentleman who works for us part-time with our youth and parent programs is also the person that started the Biddeford chapter of Young People in Recovery. And it's a national program that we're getting more and more involved in. Matt Braun couldn't be here today. He's out at a conference in Denver. But we're also trying to get that going as a collegiate program here at the university. Also, the university's been involved with the Maine Opiate Collaborative to have community forums, in this case, the Journey to Recovery, and this was in April, and we had about 80 community members show up and talk about the balancing act of pain management, but also how do we keep people from slipping into substance use disorders. Ed had mentioned earlier Project Aware as a group who work, it's a youth-driven program. These films are made by young people, they're written by young people, the music is created by young people, and there's a summer film institute that we have in a few weeks here in Biddeford that we get young people from all across the area, and we've provided scholarships for that. So these are just examples of community partners. Basically, an example that I want to share with you today is called the Northern York County Prescription Drug Coalition and what that's all about, and the Drug Take Back Days events, which you're probably well aware of. Just to give you a brief history, there were two groups of us working on the same thing at the same time and didn't know it back in 2009. We were looking at the whole area of how can we dispose of unwanted, expired, unused medicines, medications. And so Southern Maine Healthcare, which at that time was Southern Maine Medical Center, and Biddeford Savings Institute, Saco Biddeford Savings Institute right here in the area, had people that were involved that had a personal interest and wanted to know how we can dispose of these drugs properly so that we're not having them diverted to the street, and also how can we prevent environmental issues from happening if people are flushing these medications down the toilet, basically, and into our water system. And then Coastal Healthy Communities Coalition here at UNE, Old Orchard Police Department, and the relationship we had with the Old Orchard Beach Community Watch Council, we're also doing the same thing. So Becky Miller, who was from the Maine Poison Control Center, happened to meet one day when we had another relationship that was built with them, and found that, hey, you guys are doing the same thing. Why don't you get together and talk? So that's also in terms of building these relationships and building on to these partnerships and making connections. So these two groups got together over lunch and we merged. And we became a little stronger. We believe that the creation of the Northern York County Prescription Drug Coalition was the first of its kind in the state of Maine. Now, we weren't the first to plan a drug take-back day. Portland had done that. But we were very involved in how do we do this? So we started doing research and finding out from other states and other particular specialists, how can we do this in the area? Question was, how do people dispose of their unwanted, unused, or expired meds? We found through some surveys that most people kept them in their medicine cabinets. They also flushed them down the toilet and threw them out in the trash, sometimes mixing it with kitty litter because they'd heard to do that, or coffee grounds. But most of them kept them in their medicine cabinet. And how do we fund this initiative? It's expensive to dispose of at this point. And how do we keep key stakeholders interested in continuing on with the work that we're doing? Always a question, correct? So, wow. After a few meetings and the group grew, entered the U.S. Drug Enforcement Administration. We have a fantastic resident agent in charge in Portland. His name is Mike Wardrope. He would come to all our meetings, and he said, hey, guess what? We've been funded to provide all of the disposal costs. You don't have to count each pill like we were told we were going to have to do. We can have boxes. We'll take care of the logistics. And we'll hold 2 drug take-back days per year, one in the spring and one in the fall. And what we need is your support and your volunteers. But there's a protocol. We have to work with law enforcement on this, obviously. So one of our partners. Then the Maine Sheriff's Association got involved. Our sheriff in this county is Bill King, Jr., and he's been very supportive of the work that we're trying to do in this area. There's a picture of us a while ago, and that's Don from the bank, and Heather Stewart, who is a graduate of the UNE School of Pharmacy, who is very instrumental in the work that we're doing. There's Matt right there and Mike. But I have to say that there are more women on this group, okay? They're just not, they weren't there that day. I just want to keep things equal here. This is one of our flyers that get put up around town. We put it up on electronically and hard copies in grocery stores, pharmacies, etc. And it does show all the partners here working together and where the drop-off locations are going to be. And this was from about a year ago. This one was taken. And so it's very easy to get the promotion of it out there. A lot of drop-offs. You know, we want to make sure all the information is blacked out on all these, but we do accept the cases as well. Here's a group in Old Orchard, the Community Crime Watch. Fantastic group to work with. This is kind of like the gold standard of all the drop-off sites. Fantastic group. They do a lot of work. They do their own surveys, and we're very happy to be having them as partners. And there you can see, I'll show you in a second, but that's a med return box that are now in all the police departments in York County and across the state. There's many of them if you need to return meds. The only thing that we're having a challenge with right now is we cannot take sharps, and we're working on that. So we want to be able to take sharps back. So we actually help people if they call us to where they can bring sharps. Okay. Here's the collection stats, if this is of interest to you. This is when it began. Now, this is in pounds. You know how much a pill weighs, or a patch? You can see this is about right here in April of 2012. We started to see more med return boxes. But our last drug take-back day, April of 2016, we almost collected 15 tons of medications in the state of Maine. 4,000 pounds alone in York County. So what's going on here? Well, Maine is, age-wise, is the second oldest state in the country, the first being Florida. We also have many, many groups working together in their communities, giving a lot of promotion to this particular drug take. It's also national, so it hits a lot of the media. But that's a lot. That's a lot. And since we have the med return boxes in each police department lobby where there's no questions asked, they're open 24/7 in most of the departments and the sheriff's office, I'm trying to get them to break down and label what comes in a med return box and what comes in during drug take-back days. Okay, so we can kind of keep track of that. So we're working on that right now, but that's a lot of medications, isn't it? There's, these are all boxes filled with medications that go out of the evidence room, collected, and this is from Biddeford, which probably collected around 900 pounds this past drug take-back day. And that goes to a central location where it's shipped off, and then they've worked, the DEA has worked out with Maine to be able to incinerate in Maine now. We used to have to ship off to Massachusetts, now we can do that in Maine, which has been a great thing to be able to do. And they tested burning of these medications and found that it was actually very clean, that it was okay to be downwind from them. Okay. The next step for our coalition was to recruit more members. We wanted more youth, law enforcement, healthcare. We recruited pharmacists, clergy. The faith-based community has become much more active in what we're doing. School resource officers, Rotary, and yes, real estate agents and funeral home directors. What do they have to do with this? Real estate agents were finding that during open houses, they were being distracted. Have you heard about this? You should be very aware of this. And people were rifling through medicine cabinets looking for, particularly for narcotics, okay, and other types of drugs. So we want them to be aware, so we do trainings and information dissemination to real estate agencies and real estate agents. This is a real problem out here, and it's something that needs to be addressed. Funeral home directors, people with substance use disorders, with addiction, get very creative, and they want to get their substances so that they feel normal. And so we've had to work with funeral home directors because people will look in the paper in the obituaries and see when wakes are, when funerals are, and then break into their homes. And they'll rifle through everything they can to try and find these particular substances. And they'll also, I've been told by some funeral home directors that they'll see if there's any donations made to Cancer Society because they're thinking, more painkillers perhaps in that house. So very sophisticated system, and they'll go in teams. Okay, so not to be all doom and gloom about this, because there's a lot of hope and a lot of positive pieces, but that's very important in terms of cutting that down. So we want to increase visibility, and so we use a lot of print and electronic media. There's some of our youth from the Kennebunk area working with us on a number of programs. We work with senior citizens in the BodyWise program here. We have a lot of questions around medications that we like to, and interactions between, let's say, alcohol and specific drugs. Our College of Pharmacy, and this was from January of 2015, we published Inside Maine's Medicine Cabinet, Findings from the Drug Enforcement Administration's Medication Take-Back Events, with Heather Stewart and some of her colleagues here. The DEA paid for this particular study, so it's something we've been involved in. Here's a med return box right here. They're located, as I mentioned, in every police department. They look a little like mailboxes, and it gives a description of what you can accept and what isn't accepted at the moment. Okay, and those have to be emptied basically in all the police departments I've talked to about every 2 weeks. And that's how often they've been used, and these are fairly deep. Whoops. Okay, we also were charged, the Coastal Healthy Communities Coalition was also charged with creating a website. That was the next step that we wanted to do, was to create a website that people could go to and see where all the med return boxes were. And you could also go onto that website and Google directions to that particularly med return site. We can also put special events such as drug take-back days on that website and resource information, okay, that we want the public to know. And that's it right there. I don't have time to bring that up, but if you Google that, medreturnme.com, you'll see the pages. It hasn't been updated for the fall yet because we just found out that I believe September 22nd will be the next USDEA Drug Take Back Day. But we promote this through a variety of messages, through ads, social media, newsletters, electronic. We have kiosks that we put in libraries and high traffic areas, public areas. We've got little refrigerator magnets, okay, that a lot of people love to take during Drug Take Back Day. We also have rack cards for pharmacies and other places that have this information on it and more on how to reach me. If you do not use the internet, there's also information on our rack cards and business cards where they can reach me if they need to, or other people in our department. Okay, so hey, you've got a lot of information. That's probably, this is what I'm seeing right now out here. Right before lunch, and we've given you a lot of information. But I want to leave you with this request and challenge. And I apologize, but I'm going to read this, and I have to put these on because I'm from the Jurassic age. Keep the channels of communication open. Build those relationships in your community in addition to your workplace. When I grew up, I had a neighborhood that everybody knew each other. You don't see that often these days. Main Street's kind of gone away. My mother and father used to know things about me I didn't even know before I got home, okay? And that helped protect the community, you know, as citizens and as people caring for other people. We need to bring that back, in my opinion. We need to be more caring. We need to be more protective of each other and keep each other's backs. So get involved. Engage our youth. Our youth programs are some of the most effective programs when we come to evaluating programs that we've seen. Provide leadership. Work with those spark plug community members who really want to help. That's really critical. And there's plenty of individuals and community organizations who are available to do that. And we have a great resource of people here in this room and at UNE as well and outside of UNE. Above all, listen to those who have to deal with pain and those who are struggling with substance misuse and substance use disorders, or support those who are in the recovery process. It's not easy. And I'll tell you right now, it goes beyond being clean and sober. It goes to gathering a lifestyle, looking at housing, getting educated. What if you have a felony because of this use? How can we work with you to make you a stronger person, and how can we strengthen our communities? It's critical, I believe, in building healthy and caring communities. So I want to thank you, each and every one of you, for the hard work that you do in your respective fields. And I've learned a lot already this morning, and I'm sure I'll learn a lot today. Thank you so much again, Ed, for this opportunity to speak here. And I wish you well and have a wonderful and informative day here in Biddeford.
I think we have time for a question or two if there's Bonnie Pop here.
Hi, Bonnie.
Over there, Carol.
Thank you. Thanks, Bill. The question that comes to my mind is, after listening to the speakers this morning, it is clear that there seems to be a growing challenge from a public policy standpoint in terms of what are the next steps, because we have a physician talking about the increasing regulatory environment limiting what and how much can be prescribed at any time. And then we have the flip side of, to see 15 ton of pills in one, at one collection day for Maine is astonishing. We also are hearing that Maine is #1 in the nation in terms of prescriptions to medications. And so the balance, the discussions, at least I work for Senator Angus King, and I know within our team we've discussed what is the path forward? How do we look realistically at this issue in order to understand and support the medical community in doing what it needs to do? But clearly, we need to address the issue that all of those medications have been prescribed and paid for huge, huge dollars. And then we're turning around and having to pay to dispose of them, and we have concerns because of the illegal use of that. So where do we go from here?
Great question. That'll take up the rest of the afternoon. Thanks, Bonnie.
Oh, you're not going to answer that, Bill?
No way. No, I think that's an excellent question, and where do we go from here? When we met with the Maine Opiate Collaborative and we released our findings from hearing from the different communities, we did have a treatment team, a law enforcement team, and a prevention harm reduction, and found that it is a real balancing act, because we want to make sure that we don't go the opposite way and not prescribe for those who really need these types of medications. And my way of looking at it, obviously, I'm as a prevention specialist, is looking at demand reduction early on. You know, we need to look at ACEs. Are you familiar with ACEs? Adverse childhood experiences, and how critical those traumatic experiences are with young people and as they get older. And that leap from middle school to high school is a critical time where there's a lot of experimentation, especially where there's been trauma or use in the family. It runs in families. So we need to find a balance, and I really think that's a question that could take up, you know, that's a very valid question. Where do we go from here? We're working on continuing to build those relationships. I think for the first time in my career, and I've been doing this a long time, I've seen this real synergy of people working together, and perhaps this heroin slash fentanyl and all epidemic has brought a lot of attention to that and brought people out. So in that sense, it's a good thing. It's not a good thing totally, but it's something that is bringing attention to the matter and opening doors of discussion. And to answer that, I guess, is we need to talk more and communicate with each other and share ideas, and also share it with our politicians who are making these laws, and make our voice known, create a voice. Okay, thank you.